Yeah, details about weekly COVID-19 reports updates from WHO media published on 30th November. WHO COVID-19 reports updates. We can see our reports like weekly epidemiological updates rates as follows. Globally, the number of new cases remained stable, plus 2% during the week of 21st to 27 November, as compared to the previous week with just under 2.7 million new cases reported. The number of new deaths decreased by 5% as compared to the previous week with over 8,400 new fatalities reported as of 27 November 2022. Over 637 million confirmed cases and over 6.6 million have been reported globally. In this edition, we can include the COVID-19 epidemiological updates at global and regional levels, and an update on circulating SARS-CoV-2 variants of concerns, like what kind of variants were what we can say initiated. Then the related things about an update on hospitalization and ICU admission related to COVID-19. Let us see the report. It could be downloaded from the website also. It's being processed. As the details are given in this context. So let us review the same. It's about Global COVID-19 Weekly Epidemiological Updates, edition 120, published 30 November 2022. In this edition, global overview, SARS-CoV-2 variants of concern and Omicron subvariants under monitoring, WHO regional overview, hospitalization and ICU admissions. So the relevant details about global overview. Date as of 27 November 2022. It reads that globally the number of new weekly cases remained stable 2% during the week of 21st to 27 November 2022 as compared to the previous week with just under 2.7 million new cases reported. Figure 1, table 1.1. The number of new weekly deaths decreased by 5% as compared to the previous week, with over 8,400 new fatalities reported as of 27 November 2022. Over 637 million confirmed cases and over 6.6 million have been reported globally. At the regional level, the number of newly reported weekly cases decreased across 4 of the 6 WHO regions. Of the African regions, minus 18%. The Eastern Mediterranean region, minus 17%. The European region, minus 14%. And the Southeast Asian region, minus 8%. While case numbers increased in 2 WHO regions, the region of the American plus 19% and the West Pacific region plus 8%. The number of newly reported weekly deaths decreased across these regions. The African region minus 79%, the European region minus 35%, and the Eastern Mediterranean region minus 20%. While death numbers increased in 3 WHO regions, the region of the American plus 21%, the Western Pacific region plus 9%, and the Southeast Asian region plus 5%. As figure 1, COVID-19 case reported weekly by WHO region and global deaths as of 27 November 2022. These are the details and the parameters that about case loads. Then this is about the period 6 January, 27 January, 17 February, 9 March, 30 March, 20 March, April, 11th May, 1 June, 22 June, 13 July, 3 August, 24 August, 14 September, 5th October, 26 November, October. 16 November, then 7 December, 28 December, 18 January, 8 February, 1 March, 22 March, 12 April, 3rd May, 24 May, 14 June, 5th June. It's like the given time period for observation. Then 26 July, 16 August, 5th September, 27 September, 18 October, 8 November, 29 November, 20 December, 10 January, 31st January, 21st February, 14th March, 4 April, 25 April, 16 May, 6 June, 27 June, then 18 July, then 8 August, 29 August, 19 September, 10 October, 31st October, and 21st November. About case loads and dates. The French dates that there were increase in cases during March, then it declined during March 32 May. There was seasonal change. Then there were fluctuations between May to October, mean the season, rainy season. There were less case loads and less deaths. Then suddenly the case loads increased during October, 5th October to 18th January, and it was at optimum on 18th January. Then about the regions, it is being color coded. There were more cases in America than in Europe, and there were little in Southeast Asia and minors in other regions like Eastern Mediterranean, African, Western Pacific. Then about deaths, that death line decreased during another March, from January to 1st March. Again, death rates increased from March to May, and again it decreased from May to July. The trend was declining during 14th July, then it increased during July to August. Again it decreased in the next quarter, next what we can say 15 days. Again it increased in the next 15 days. Again it decreased. So it reflects a special pattern that how these things are affecting across the globe, and the trend continues for other months also. There were further increase during winter seasons. So it is inevitable that winter related COVID-19 deaths are matter of concern that express the immunocompromised peoples, that how they are affected. Then another relates that interpretation gives edge. At the country level, the highest number of new weekly cases were reported from Japan, 6,19,770 new cases, plus 18%. Then the Republic of Korea, 3,78,751 new cases, plus 4%. Then the United States of America, 2,96,882 new cases, plus 8%. From France, 2,30,871 new cases, minus 1%. And Italy, 161,454 new cases, minus 27%. The highest numbers of new weekly deaths were reported from the United States of America, 2,611 new deaths, plus 16%. From Japan, 1,000 new deaths, plus 42%. From Brazil, 535 new deaths, plus 113%. From Italy, 419 new deaths, minus 22%. And China, 395 new deaths, minus 17%. Current trends in reported COVID-19 cases should be interpreted with caution, as several countries have been progressively changing COVID-19 testing strategies, resulting in lower overall numbers of tests performed and consequently lower numbers of cases detected. COVID-19 prevalence surveys conducted in a number of countries have found that the number of reported COVID-19 cases is an underestimate of the actual number of cases in the population. Additionally, data from previous weeks are continuously updated to retrospective incorporated changes in reported COVID-19 cases and deaths made by countries. Table 1, newly reported and cumulative COVID-19 confirmed cases and deaths by WHO region as of 27 November 2022. Let's think about WHO regions. Then new cases in last 7 days, change in new cases in last 7 days, cumulative cases percentage, new death in last 7 days percentage, change in new deaths in last 7 days, then cumulative deaths. Think about Western Pacific regions. There were 12,92,141, 80%, 48% new cases in last 7 days, and the change in new case in last 7 days was 8%. Again, the related facts about its cumulative cases were overall 98 lakh 9 crore 82 lakh 30,000 33, 15% increase. Overburden 15%. The new death in last 7 days was 1,898, 22%. Change in new death in last 7 days was 9%, and cumulative death percent was 2,82,552. It was 4%. Then about Europe, there were 7,71,981 new cases in last 7 days, about 29% of the total caseload, and change was decreased by 14%, and the cumulative was 26 2 crore 64 26 crore 44 lakh 18,870, 41%. Deaths in last 7 days was 2,254, 27%. And change in new death in last 7 days was minus 35%. And cumulative deaths were 21,34,396, 32%. And with reference to Americans, there were total caseload percentage was 21%, about 5,50,990. And case in new case in last 7 days was 19%, and the cumulative case percentage was 29%, like 18 crore 18 lakh 61,099. And new deaths were reported as 45%, 3,821. Change in new death in last 7 days was 21%, and cumulative deaths were 28,69,470, 43%. Then with reference to Southeast Asia, there were total caseload percentage was 2%, 49,879. Change in new cases in last 7 days was minus 8%. Cumulative cases were 10%, like 60 lakh 66 crore 6 lakh 42,718. And the new deaths in last 7 days were 420, 5%. Changes in new death in last 7 days were 5%, and cumulative deaths were 8 lakh 1,676, 12%. With reference to the Eastern Mediterranean, like it decreased by, it is less than 1%, like 7,633. Change in new case minus 17%. Cumulative case percentage 2 crore 31 lakh 91,725, and it was less than 40%. New deaths 40, and change in new deaths is minus 20%. It decreased, and its percentage cumulative death percentage was 3,48,896. With reference to Africa, there were less than 1%, 6,482, and changes in new case in last 7 days was minus 18%. Cumulative cases percentage were 93,92,341, 1%, and it was less than 1%, 9 for death, and the change in new death in last 7 days were minus 79%, and cumulative deaths percentage were 3%, like 1,74,871. So with reference to the global trends for new cases, we can see that there were more cases in Western Pacific. Europe came at second position, Americans at third positions, then Southeast Asian, Eastern Mediterranean, and Africans. It means respective climatic conditions determines health and well-being of the people, that how their immunity is compromised. or how they can cope up with the adverse circumstances to remain healthy. So these are the percentage change in confirmed COVID-19 cases over the last 7 days relative to the previous 7 days, 21 to 27 November 2022. There are the details. Then let's think about the color code, how it is representing. Red indicates about increasing. Then blue about decreasing. So where cases are increasing in Southern American countries, but Western Southern American countries like in Chile, it is decreasing. With reference to Mexico, case loads are decreasing, but cases are increasing in Cuba. With reference to United States of America and Canada, it is stable. Here, with reference to African countries, cases are increasing in Nigeria. It's stable in Namibia, Botswana, and South Africa. It is decreasing. Then same trends are observed in other countries also. We can see about the trends. It is increasing in this special person, Guinea region. Here we can see it is increasing. Here it is increasing. Here there are increasing case loads. Then here cases are increasing. So there are factors related with its observation. Then think about other regions as cases are increasing in Sri Lanka, but it is stable in India. Cases are increasing in the Southeast Asian countries, but cases are increasing in this country. So what are the related factors? Why cases are increasing in Oman? Why there are increasing COVID-19 infection cases in these regions? Relevant statistics could be assessed for its proper examination. These are the details, and with reference to the dates, figure 3 percentage change in confirmed COVID-19 deaths over the last 7 days relative to the previous 7 days, 21 to 27 November 2022, as there were more deaths in this Southern American countries. So what are the related factors that is causing more death in countries? Then here again in this South African countries, it is mentioned that cases are increasing at there in these places, right? With reference to United States of America, there were trends that it is increasing, but not up to the extent how it is increasing in this South American countries. Then think about other countries, the related factors for observation. The same trends are implied for this African countries also. Then its related descriptions, let us review the same. Like SARS-CoV-2 variants of concerns and Omicron subvariants under monitoring. A report indicates that geographic spread and prevalence of VOC, variant of concerns, globally from 28 October to 28 November 2022. There were this much SARS-CoV-2 sequence were shared through GISAID. Among these 94,485 sequences were the Omicron variant of concern, accounting for 99.9% of sequences reported globally in past 30 days. The trends describing the circulation of Omicron descendants lineage should be interpreted with due consideration of the limitations of the COVID-19 surveillance system, This includes differences in sequencing capacity and sampling strategies between countries, changes in sampling strategies over time, reduction in tests conducted and sequences shared by countries, and delays in sequence submission. The majority of sequences submitted to GISAID are from countries with high sequencing capacity, mostly high income countries. Therefore, sequencing information provided may not be representatives of the global situations of SARS-CoV-2. During epidemiological weeks 45, 7 to 13 November 2022, its 45th week, BA5 and all its descendants lineage continued to be dominant globally, accounting for 73% of sequences submitted to GISAID. The prevalence of BA2 and its descendants lineage increased from 7.9% in epidemiological week 44th, 31st October to 6 November to 10.1% in week 45th, 7 to 13th November. During the same period, BA4 descendants lineage declined from 3.4% to 2.8%. Unassigned sequences, like presumed to be Omicron, accounted for 10.1% of the sequences submitted to GISAID in week 45. Think about like a comparison of sequences submitted during week 44 and 45 shows an increase from 23.1% to 27.3% for BQ1 and its descendants lineage. As of 28th November, BQ1 has over 30% descendants lineage BQ1 during the same period. The prevalence of XBB and its descendants lineage increased from 2.7% to 3.8%. BA2.75 increased from 5.4% to 6.6%, while BA4.6 decreased from 3.1% to 2.9%. BA2.3 remained relatively stable at 0.4% in both weeks. So these are the statistics. Let's review other related reports like WHO Regional Overview, Epidemiological, week 21 to 27 November 2022 from African region. The African region reported 6,082 new cases and 18% decrease as compared to the previous weeks. 6% of the 49 countries for which data are available reported increased in new cases of 20% or greater, with the highest proportional increase observed in Zambia, 35 versus 11 new cases, plus 218%. Mayotte, 564 versus 194 new cases, plus 186%. And Reunion, 893 versus 575 new cases, plus 55%. The highest numbers of new cases were reported from South Africa, 2,637 new cases, 4.4% new cases per 100, minus 35%. Angola, 1,360 new cases, 4.1 new cases per 1 lakh. No cases reported the previous week. And Reunion, 893 new cases, 99.7 new cases per 1 lakh, plus 55%. The number of new weekly deaths in the region decreased by 79% as compared to the previous weeks, with 9 new deaths reported. The highest numbers of new deaths were reported from Angola, 6 new deaths, less than 1 new deaths per 1 lakh. No deaths reported the previous week. Then with reference to Zambia, 2 new deaths, less than 1 new death per 1 lakh. No death reported the previous week. And Cabo Verde, 1 new death, minus 1% new death per 1 lakh. The same number of deaths reported the previous week. Then this statistics represents about cases and deaths. Cases are denoted in blue and deaths are reported in this black line. It reflects that there are special trends for its prevalence, that how cases increased as there were less cases during 9th March. It increased when season changed during 9th March to 20 April. Again, there were stable season, but the cases were increasing and it reached up to peak by 13th July when there were hot summer. Again, it decreased when the season were changed from summer to rainy seasons by October. When we see that from October to December last year, cases were at peak. So there are factors related with immunocompromised peoples due to the seasonal variations. Again, the cases decreased as like the climatic conditions stabilized from 28th December till March. The trends express declining of the both infection as well as deaths, and it reached up to minimum by May. Means the next summer were a bit uh, calming because there were less infestation and less deaths. Again, it increased during May, 3rd May till July. There were increasing cases as well as deaths. Again, it decreased, again, it increased, but there were more cases and less deaths. Again, relatively changes could be evident, but now cases and deaths are decreasing across the globe. These are the patterns as explained. Then think about others regions of America. The region of Americans reported just under 5,51,000 new cases, a 19% increase as compared to the previous week. 29% of the 56 countries for which data are available reported increased in new cases of 20% or greater, with highest proportional increase observed in Saint Pierre and Miquelino, 17 versus 3 new cases, plus 467%. Honduras 15 versus 102 new cases, plus 405%, and Paraguay 93 versus 22 new cases, plus 323%. The highest numbers of new cases were reported from the United States of America, 296,882 new cases, 89.7 new cases per 1 lakh, plus 8%. From Brazil, it were like 1,50,000 new cases, 70.6 new cases per 1 lakh, plus 64%. And from Chile, 33,684 new cases, 176.2 new cases per 1 lakh. The number of new weekly deaths in the region increased by 21% as compared to the previous weeks, with 3,821 new deaths reported. The highest numbers of new deaths were reported from the United States of America, 2,611 new deaths, less than 1 new deaths per 1 lakh, plus 16%. From Brazil, 535 new deaths, less than 1 new deaths per 1 lakh, plus 113%. And from Canada, 268 new deaths, less than 1% new deaths per 1 lakh, minus 10%. About cases and death prevalence, we can see that how it happens. Like there were less deaths, less cases during January to March, but cases and deaths increased, and it reached up to peak by August. Again, it decreased by October, and between October to December, cases decreased. It reached at peak by 18 January. Again, it decreased by March. Again, it increased during March to April. Again, it decreased. So the related facts explains about how it is happening, but let us see about the latest trends as cases and deaths are decreasing across the globe. Then reference to the East Mediterranean region. The Eastern Mediterranean region reports 7,633 new cases, a 17% decrease as compared to the previous weeks. 14% of the 24 countries for which data are available reported increase in new cases of 20% or greater, with the highest proportional increase observed in Tunisia, 192 of 97 new cases. 98% from Morocco, 1,029 versus 705 new cases, plus 46%. And from Egypt, 11 versus 8 new cases, plus 98%. From Morocco, it is 1,029 versus 705 new cases. As mentioned, from it's 46% increase, and from Egypt 11 versus 8 new cases, it's 38% increase. The highest numbers of new cases were reported from Qatar, 1,794 new cases, 63.3% new cases per 1 lakh, minus 18%. And from United Arab Emirates, 1,458 new cases, 14.7% new cases per 1 lakh, minus 4%. There were decrease. And from Morocco, 1,029 new cases, 2.8 new cases per 1 lakh plus 46%. The number of new weekly deaths in the region decreased by 20% as compared to the previous weeks, with 40 new deaths reported. The highest numbers of new deaths were reported from Saudi Arabia, 11 new deaths, less than 1 new death per 1 lakh, minus 21%. From the Islamic Republic of Iran, 8 new deaths, less than 1 new deaths per 1 lakh. It was decreased by 47%. From Lebanon, 7 new deaths, less than 1 new deaths per 1 lakh, the same number of deaths reported the previous weeks. Here the prevalence of cases and death, we can see same trend of increase and decrease in caseload and deaths. The same trends are reported and observed. During 6 January to March, there were less deaths, less cases, but the cases and death rates increased during next quarter. Again, there was stability. Again, it increased. Again, there were decrease. Again, the trends increased and decreased. So it reflects that there are evident effect of seasonal change on regulation of the immunity of the peoples, which leads their infection and related deaths. With reference to the European region, like the European region reports just under 7,72,000 new cases, a 14% decrease as compared to previous weeks. 13% of the 61 countries for which data are available reported increase in new cases of 20% or greater, with the highest proportion increase observed in Kosovo, 11 versus 1 new cases, plus 1000%. It is remarkable that it has very different trend, that more cases were reported from Kosovo, plus 1000%. Why it is so? It need to be checked properly. From Uzbekistan, 692 versus 428 new cases, plus 62%. From Kyrgyzstan, 28 versus 19 new cases, 47%. The highest numbers of new cases were reported from France, 2,30,871 new cases, 355 new cases per 1 lakh, minus 1%. From Italy, 1,61,454 new cases, 270.7 new cases per 1 lakh, minus 27%. And from Germany, 1,51,867 new cases, 182.6 new cases per 1 lakh, minus 10%. The number of new weekly deaths in the region decreased by 34% as compared to the previous weeks, with 2,254 new deaths reported. The highest numbers of new deaths were reported from Italy, 419 new deaths, less than 1 new deaths per 1 lakh, minus 22%. From France, it's 387 new deaths, less than 1 new deaths per 1 lakh, minus 25%. With reference to the Russian Federation, 386 new deaths, less than 1% new deaths per 1 lakh, minus 10%. The prevalence of cases and deaths are reported as there were more deaths during March. There were decline in case rate and death during March to August. It was at minimum. Then again, deaths and cases increased during August to October. Again, it decreased during October to February. It increased during February to March. Again, it decreased from March 21 to till July. Again, cases increased during July to November. Again, it decreased. So this is the trend given with reference to the European regions. The descriptions related to Southeast Asian regions are as follows. Like the Southeast Asian regions report over 49,000 new cases, as 8% decrease as compared to the previous weeks. 20% of the 10 countries for which data are available reported increase in new cases of 20% or greater, with the highest proportional increase observed in Sri Lanka, 133 versus 88 new cases, plus 51%. In Thailand, 4,914 new cases, 7 new cases per 1 lakh, plus 24%. The highest number of new cases were reported from Indonesia, 41,877 new cases, 15.3 new cases per 1 lakh, minus 11%. From Thailand, 4,914 new cases, 7 new cases per 1 lakh plus 24%. And from India, 2,547 new cases, less than 1 new cases per 1 lakh minus 3%. So these are the notions and the observable reports about the preventive measures and curative treatments availed by the health facilities of the respective countries. Like the number of new weekly deaths in the region increased by 5% as compared to the previous weeks, with 420 new deaths reported. The highest number of new deaths were reported from Indonesia, 297 new deaths, less than 1 new death per 1 lakh plus 8%. From Thailand, 74 new deaths, less than 1 new deaths per 1 lakh plus 7%. And India, 38 new deaths, less than 1 new deaths per 1 lakh minus 12%. Here the rates related with cases and deaths, that there were less cases during January to May, but case load increased during May to September. Means May, June, July, August, September, like in summer and winter, there are more infections and more deaths. But when the season reaches its peaks, the cases and deaths decreased till March, but it reached at peak during March to May. Again it decreased during May to July, and it increased during July to August. Again it decreased from August to December, but it cases increased, but deaths were like respectively less than the infection. And now the latest trends explains that there are certain uh, notions of relaxations because there are less infections and less deaths reported. Now think about the other regions, like for Western Pacific regions. The Western Pacific region reports about 1.2 million new cases, an 8% increase as compared to the previous weeks. 12% of the 34 countries for which data are available reported increase in new cases of 20% or greater, with the highest proportional increase observed in Fiji, 68 versus 20 new cases, plus 240%. From Singapore, 13,800 versus 10,918 new cases, plus 26%. And Lao People's Democratic Republic, 132 versus 105 new cases, plus 26%. The highest numbers of new cases were reported from Japan, 6,98,772 new cases, 552.5 new cases per 1 lakh, plus 18%. From the Republic of Korea, it was 3,78,751 new cases, 738.7 new cases per 1 lakh, plus 4%. And from China, 1,44,205 new cases, 9.8 new cases per 1 lakh, minus 9%. Number of new weekly deaths in the region increased by 9% as compared to the previous weeks, with 1,898 new deaths reported. The highest numbers of new deaths were reported from Japan, 1,000 new deaths, less than 1% new deaths per 1 lakh, plus 42%. From China, 395 new deaths, less than 1 new death per 1 lakh, minus 17%. And the Republic of Korea, 338 new deaths, less than 1 new deaths per 1 lakh, minus 8%. So these are the descriptions about cases and prevalence of death in Western Pacific regions. We can see there were more deaths during 2021. During the July to August to September 2021, there were more deaths. Again, it decreased in 2022. There were more deaths during 21st February to 4th April 2022. Again, cases decreased. It increased during August and September. Again, there are notions for decrease, but the latest trends explains that case loads are increasing, and case loads are increasing and deaths are also increasing, but it is less than 2,000 deaths per 1 lakh. Let us think about other given reports about hospitalizations and ICU admissions. Globally, in week 46, 12% countries reported data to WHO on new hospitalization. The region with the highest proportion of countries reporting data on new hospitalizations was the European region, 28% from 17 countries, followed by Eastern Mediterranean region, 18%, 4 countries, the Western Pacific regions, 9%, 3 countries, the Southeast Asia region, 9%, 1 country, the region of the Americans, 4%, 2 countries, and the African regions, 2%, 1 country. At the global level, during Epidemiological Week 46, 14 to 20 November 2022, a total 33,339 new hospitalizations and 829 new intensive care units admissions were reported. The presented hospitalizations data are preliminary and might change as new data become available. Furthermore, hospitalizations data are subject to reporting delays. These data are also likely to include both hospitalization with incidental cases of SARS-CoV-2 infections and these due to COVID-19 diseases. Across the 6 WHO regions in week 46, a total 14%, 6% countries reported data to WHO on new ICU admissions. The region with the highest proportions of countries reported data on new ICU admissions was the Eastern Mediterranean region, 40%, 3 countries, followed by the European regions, 11%, 7 countries, the Western Pacific regions, 9%, 3 countries, and the region of the American, 2%, 1 country. So far, no country in the South East Asia region and the African regions has reported data on new ICU admissions during week 46. Among the 18 countries that reported more than 50 new hospitalizations, 6 countries shows an increasing trends compared to the previous week. Uzbekistan 141 versus 69 new hospitalization plus 204%. From China 14,803 versus 9,639 new hospitalizations plus 54%. From France 5,311 versus 4,002 new hospitalizations plus 33%. From South Africa 61 versus 50 new hospitalizations plus 22%. From Malaysia 4,502 versus 4,145 new hospitalizations plus 9%. And from Greece 1,360 versus 1,292 new hospitalizations plus 5%. Among the 6 countries that reported more than 10 new ICU admissions, 2 countries shows an increased trends compared to the previous weeks. France 17 versus 356 new ICU admissions plus 34%, and from Malaysia 93 versus 81 new ICU submissions plus 15%. Figures like COVID-19 cases, deaths, hospitalization and ICU admission reported weekly to WHO as of 20 November 2022. It is about the trend. The data explains about the number of cases daily, how cases emerged. Then blue defines number of deaths daily, and new number of admissions is explained to ICUs is denoted into this purple color. The 3-color code explains the prevalence, during January 2022 to July 22, there were increase in infection as well as deaths. It reached up to the peak by January 2021. Again, it decreased during January to March 2021. It increased during March to June 2021. It decreased during June to July 2021. March to July 2021. Again, it increased during July 2020 to August or September, October 2021. Again, it decreased from October 2021 till January 2022, but it increased during January 2022 and onwards. But let us think about its trend in 2022, like the cases, infections, hospitalizations, and prevalence of deaths are decreasing across the regions. Again, the details explains that answer 1 data table and figure notes. Data presented are based on official laboratory confirmed COVID-19 cases and deaths reported to WHO by country, territories, areas, largely based upon WHO cases, definitions, and surveillance guidance, while steps are taken To ensure accuracy and reliability, all data are subject to continuous verification and change, and cautions must be taken when interpreting this data, as several factors influences the accounts presented with valuable understanding of the true case and its incidences and variable delays to reflecting these data at the global level. Case detection, inclusion criteria, testing strategies, reporting practices, and data cutoff and lag times differ between countries or territories or areas. A small number of countries, territories, areas reported combined probable and laboratory confirmed cases. Differences are to be expected between information product published by WHO, national public health authorities, and other sources. A record of historic data adjustment made is available upon request by emailing. We can ask for data at api-data-support at who.in. Please specify the countries of interest, time period, and purpose of the request, intended usage. Prior situation reports will not be edited. Like see COVID-19 WHO INT for more up-to-date data. COVID-19 confirmed cases and deaths reported in the last 7 days by countries, territories, and areas, and WHO regions reported in previous issues are now available at https covid19.who.int/table. Countries may refer to countries, territories, areas, or other jurisdictions of similar status. The designations employed and the presentations of these materials do not imply the expression of any opinion whatsoever on the part of WHO concerning the legal status of any country, territory, or area, or of its authorities, of concerning the delimitation of its frontiers or boundaries. Dotted and dashed lines on maps represents approximate border lines for which there may not yet be full agreement. Countries, territories, and areas are arranged under the administering WHO region. The mention of a specific companies or of certain manufacturers' products does not imply that they are endorsed or recommended by WHO in preference to others or a similar nature that are not mentioned. Errors and omissions except the names of proprietary products are distinguished by initial capital letters. All references to Kosovo should be understood to be in the context of the United Nations Security Council resolutions. Release 1244, referred by the UNSC and published by in 1999. In the map, the number of cases of Siberia and Kosovo, UN Security Council Review 1244, according to 1999, have been aggregated for visualization purposes. Like a dispute exists between the governments of Argentina and the United Kingdom of Great Britain and Northern Ireland concerning sovereignty over the Falklands Islands, Malvinas. Updates on the COVID-19 outbreak in the Republic of Korea are not included in this report as the number of laboratory confirmed COVID-19 cases is not reported. Hence, Korea should also report the relevant reports to the WHO so that the related reports could be included into this global broadcast. Annex 2 mentions about SARS-CoV-2 variants assessment and classifications. Like WHO in collaboration with national authorities, institutions, and researchers routinely assesses if variants of SARS-CoV-2 after transmission or disease characteristics or impact the effectiveness of vaccines, therapeutics, diagnostics, or public health and social measures applied to control disease spread. Potential variants of concerns, VOCs, variants of interest, VOIs, variants under monitoring, VOMs are regularly assessed based on the risk posed to global public health. The classifications of variants will be revised as needed to reflect the continuous evolution of the circulating variants and their changing epidemiology. Criteria for variants classifications and the list of currently circulating and previously circulating. VOCs, VOIs, and VOMs are available on WHO tracking SARS-CoV-2 variant website. Then national authorities may choose to designate other variants and are strongly encouraged to investigate and report newly emerging variants and their impact. WHO continues to monitor SARS-CoV-2 variants, including descendants lineage of variant term concerns, to track changes in prevalence and viral characteristics. The current trends describing the circulation of Omicron descendants lineage should be interpreted with due considerations of the limitations of the COVID-19 surveillance system. These include differences in sequencing capacity and sampling strategies between countries, changes in sampling strategies over time, reduction in tests conducted and sequences shared by countries, and delay in uploading sequence data to GISAID. The references are given that could be referred for its proper understanding. These are the details. Further related reports are available here. The updates were explained as we browse the website. The link we followed. Then there are other related reports that could be assessed, that could be tracked, because several things are being broadcasted, monitored with reference to the WHO's publication and its management. Now, for its management, donors making differences with shipments of vital supplies, like new stories from WHO staff reports on timely deliveries to Ukraine's war-torn city of Kherson to Mogadishu, Somalia, after a devastating car bomb attack, and to Benghazi, Libya, to fill urgent healthcare needs. We also feature stories on new contributions of equipments and supplies to build health system in Burundi, Niger, Paraguay, and more. Related details could be accessed at the website. The things are mentioned with reference to the things like WHO is delivering medical supplies to the war-torn Kherson. Supply trucks arrive in Kherson in mid-November by WHO. WHO uploaded life-saving medical supplies to Kherson in November, day after the government of Ukraine regained control of the embattled city. Shipments so far have bought generators for medical facilities, surgical kits, and medicines for thousands of people. These supplies will save lives and go towards ensuring that the resilient health system can continue delivering care in these challenging circumstances and support hundreds of thousands of people, said Dr. Giorno Habit, WHO representatives in Ukraine. We can read more. With reference to the emergency supply, help blast victims in Somalia. Emergency medical supplies arrive in Mogadishu. Like WHO and contributors have been working together to maintain a stream of medical supplies to Mogadishu to treat survivors of recent car bomb attacks that killed more than 100 people and injured more than 300. The supplies are for treating traumatic injuries, including burns. These emergency medical supplies are critically needed to ensure that essential medicines and infusions are available in Mogadishu to care for victims of the blast and prevent further loss of life, said WHO Regional Director for the Eastern Mediterranean, Dr. Ahmad Al Mandhari. Shipments arrived in Burundi to strengthen health services across the board. Like the November shipment included laboratory supplies, gynecology and obstetrics equipments, hospital beds, medicines, electronic tablets, and an array of other essential healthcare materials. The new materials will help Burundi better equip its communal hospitals, Ebola treatment centers, and COVID-19 operations. Without this support, we are taking another step towards the goal of strengthening the health system to make it resilient to shocks. But above all, we want to contribute to the improvement of care structures at the service of populations. WHO representatives Dr. Xavier Crespian said. Then many partners contributed funds for the shipments. among them the European Union, Gavi, the Vaccine Alliance, and Sweden. With reference to the supplies to meet urgent medical needs arrived in Libya, like emergency health kits arrived in late October in Bangji, bound for health facilities across Libya. 70 tons of medical supplies donated by United States Agency for International Development arrived in Libya in October, including emergency kits and supplies to treat cancer and burns. Today's airlifted supplies will meet urgent health needs, especially in some of the most remote and vulnerable areas across the country, said Dr. Richard Brennan, Director of WHO Health Emergency Program in the Eastern Mediterranean region. Greetings the shipments in Benghazi. The WHO has delivered medicines, medical supplies, and equipments to 140 public health facilities across Libya to help the country strengthen its health system. Again, details are given like Paraguay builds its vaccination capacity with help from United States. Like a new mobile unit will help Paraguay bring COVID-19 vaccines to people who live far from healthcare facilities. As Paraguay receives a large shipments of equipments from the United States of America in November that will boost the country's ability to provide COVID-19 vaccinations, even in remote areas with difficult terrain. The donations of vehicles, refrigeration equipments, computers, and other supplies seek to improve access to vaccination, mainly for Paraguay's most economically and socially vulnerable people. Details are given like in Yemen, WHO and CERF support care for severely malnourished children. This photostorm from WHO's Yemen office visits the therapeutic feeding center at Kara General Hospital in Merit to show how organizations and its partners are children from starvation, are rescuing children from starvation. Then awareness raising work in Niger helps raise vaccination rate. Like with support from the European Union and the partners, more than 6,800 town criers and 3,300 community outreach workers are promoting COVID-19 vaccination throughout the country. Leaders are helping to spread acceptance that vaccines are tools to build herd immunity and stop the pandemic, said Dr. Zamila Arjika Lele, head of an integrated health center in the city of Maradi. Then WHO thanks all governments, organizations, and individuals who are contributing to the organization's work, with a special appreciations for those who have provided full, flexible contributions to maintain a strong, independent WHO. Donors and partners featured in this week's storage includes like from Canada, DG near Direct Relief, Dubai International Humanitarian City, ENI, European Union, Gavi, the Vaccine Alliance, Germany, Gates Global Polio Eradication Initiatives, Korea International Cooperation Agency, National Oil Corporation Libya, Repsol Sweden, Swiss Agency for Development and Cooperation, Total Energies Ukraine Humanitarian Fund, United Arab Emirates, United Nations Central Emergency Response Fund, UNOPS, United States of America. So newsletters could be subscribed. We can subscribe. You can also follow the link to subscribe the WHO newsletters. These are the details like media distributions list. If you will subscribe, you will gain the relevant details. You can input your email ID and other details so that you can mention about your organization. You can share, you can mention about your details, and relevant details could be faced from the uh, organization. There are like WHO newsletters you can subscribe. Other subscriptions you can subscribe. like health emergency highlights. It will give you details about health emergency highlights. Subscribe it. So the related details could be faced, like where there are passage. Then for other organizations, like details on what we can say, these are the other things that could give you the details, like cervical cancer free future updates, like 11 details could be faced. MIS is developed and the relevant details could be faced from the like interactive websites. Then for other things, like information network for epidemics, API even newsletters. There's like for like cities, urban areas, health, food agriculture, and pandemic management sector work, like academia research, and like what we are thinking, like thinking about academia and research. Like about bridges, there are bridges. It is working. The responsive website. About other details for elimination of open, it's about monthly newsletter. Monthly newsletters related informations could be faced for understanding about its related relevancy and utility to understand. So onwards, the 11 reports could be faced from these things. It is about vaccine partnership. subscribe so the related informations could be extracted. So these are the system and process established by the organizations for data exchange. There are other related news. As we can see, so these are the details. Then tie this session like Carla, the vaccine advocate, like she want to express something. Let us review the message.
I light it up, but touch headpiece? Exactly. It's best I plug some chicken feathers and wear that. I didn't know let us still play Kitty's Carnival. Oh gosh, we just watching the band launches.
Carla, how you feel about it for next year? Cause I boosted and ready for the road.
Girl, I still cautious about all them crowds and COVID. You think anybody going on social distance? Or how much people take their vaccine and their booster shots? We all have our parts to play to keep each other safe.
But all your speeding and just forget about Christmas. I don't tell all my family from foreign. Make sure you're vaccinated and boosted before you reach here, or you will sleep outside.
Yes, I know Uncle Jerry not playing with COVID, especially with his heart problem. You know Christmas is our next jam-up scene.
Girl, just make sure you have your sanitizer handy and lime outside in a fully ventilated space. To breathe now.
Uncle Jerry, I hear you still have pastels in the fridge.
I can do a two of that right now.
Choose the facts. Choose life. A message from the Pan American Health Organization, World Health Organization.
So in this manner, the interactive informations could be faced and absorbed. Again, how it is happening, and the relevant news updates could be absorbed from these things. Let us think about the other news, from WHO emergency agents, how it is happening. So in this manner, this functions. So these are the facts. Then about other news updates, you can see, you can browse, you can work. So this is the way how we can